Welcome back, everyone. We want to put the focus on heart health, and St. Francis Hospital and Trinity Health of New England have access to some of the most advanced treatments available for diagnosing and for treating heart rhythm problems.
And joining us now in the studio is Dr. Will Gianfrido, and he is the Associate Chief of Cardiac Electrophysiology at St. Francis Hospital. Thank you so much for being here, Doctor.
Thanks for having me, yeah.
This is a big word. Tell us, what is cardiac electrophysiology?
Yeah, so cardiac electrophysiology is a subspecialty of cardiology that focuses on heart rhythm disorders and the heart's electrical system.
Okay.
So for every part of the heart, there's a subspecialty of cardiology. The interventional cardiologists are the plumbers, we are the electricians.
Oh, okay. I like that analogy.
I like that, yeah.
And there are some people who are born with, these heart murmurs and arrhythmias, right? Or you can develop it later on in life?
Yeah, that's right. So some arrhythmias you are born with, and they may manifest in childhood. Then the pediatric cardiac electrophysiologists would usually manage those. Some of them will always be there and then manifest later in adulthood, and patients will come in and see me for those.
Now, one that's pretty common that I guess we all need to be worried about and get checked out for is adult AFib.
Yes.
What exactly is that? And you treat it, right?
AFib is the most common heart rhythm disorder that we see and that we deal with. About 5 million people in the United States are affected by it, and the risk of atrial fibrillation increases with age. So as folks enter into the later decades of life, it becomes more and more prevalent, and then they need to seek our care to manage it. It's an abnormal rhythm of the top chambers of the heart, where the top chambers fibrillate. They just kind of wiggle like this instead of beating in sync. And it can be pretty symptomatic for patients and can affect their quality of life.
And what are some of the symptoms that people should be on the lookout for?
The classic symptoms that we think of are heart racing, palpitations, skipped beats, chest pain, sometimes lightheadedness, sometimes people faint. But some of the more subtle symptoms that people don't necessarily associate with atrial fibrillation that can slide under the radar are fatigue, just a little bit of shortness of breath with exertion and exertional intolerance. So if patients are saying, I don't quite feel right like myself, but they don't know that their heart is racing or that their heart is irregular, those can be symptoms of that.
Yeah, so important. I feel like in all these years of doing stories, there's always the golden moment was when they decided to actually go get help. So if you don't feel like yourself, you want to get this checked out, talk about some of the advanced treatments you have.
Sure, yeah. If you are not feeling like yourself, you should first check with your primary care physician. Sometimes your primary care physician will refer you to a cardiologist, and sometimes the cardiologist will refer you to me. We manage atrial fibrillation in several different ways. First and foremost, I always tell patients that my first, second, third prescriptions are always lifestyle modification, diet change, exercise, and if you drink alcohol or smoke, you should really try to refrain from those types of activities. Okay. Then from my end, we can prescribe medications, or we can perform catheter-based ablation procedures. And that's where we go into the heart through the veins in the leg with catheters. We find the area of the heart where the atrial fibrillation or other heart rhythm disorders are coming from, and we perform an ablation. It's almost like a cauterization of the abnormal tissue that's firing abnormally in order to get that under control and to provide patients with some symptomatic relief.
Wow, that's amazing. And we were also reading up that you do 3D cardiac mapping as well?
Yes, exactly. At St. Francis, we have basically everything that the world of cardiac electrophysiology has to offer, and that includes 3D mapping. It includes 3 different types of ablation technology: radiofrequency ablation, which is heat, cryoablation, which is cold, and a new pulsed field ablation, PFA, that delivers electrical impulses to target heart tissue specifically.
Wow. Yeah. We're going to be almost out of time, but if there's a couple of, you said food and lifestyle, what are your top 3?
Top 3 for food and lifestyle?
To change.
To change? Well, if you can lose just a tiny bit of weight, 10%, that can help with blood pressure, that can help with heart arrhythmia disorders. The other thing is get treated for sleep apnea, if you have sleep apnea, and make sure that when you eat dinner or when you eat foods, pick things that grow, swim, fly, or run, Whole foods, non-processed, and have half of your plate be vegetables or fruits.
Grow, swim, fly, or run.
I love that.
I love that.
Yeah, I love that.
That's great.
I've heard that another way, like it either needs to have a mother or come from the ground. Yeah.
Exactly.
Okay. Okay. So those are all good tips, and so a lot of that is in our control. So thank you for
Thank you,
helping.
doctor.
Yeah. And you can learn more by visiting Trinity Health of New England. It's trinityhealthofne.org/heart. You can also follow along on Facebook and on Instagram at St. Francis CT. Thanks so much.
Thank you.
All right, we're switching gears now.